Morning, Fort Chipewyan Wellness. Most of the other communities in Alberta and Canada, the non-Native communities, are gifted with other physicians, but the Aboriginal communities do not have physicians, and I feel that it's important that as an Aboriginal person I serve Aboriginal people, whether it be my own reserve or a different community. I've been here 3 years, which isn't long. And the first year I came, a lot of people were out fishing and hunting, and I went out with friends as well. And over the last 3 years, the number of people that are actually eating fish and the wild game is really decreasing. And a number of the elders that have come in said, well, what's the use of spending my time fishing when I can't eat the fish? Or what's the use of going hunting when we can't eat the meat? And so there's a couple of things going on. One is there's going to be a big change in lifestyle in this community, which is not going to be healthy. And emotionally, mentally, spiritually, and physically, it's not going to be healthy for them. And they're losing their culture. They have a very strong culture. The languages are really strong in this community. And the lifestyle in terms of being out in the bush, hunting, fishing, being with their children out in the bush is going to change because they're spending a lot more time in town. Not only that, but they're forced to buy from the only store in town, which is a northern, and the prices are really expensive for food in the north. So we're probably going to see a change in an increase in diabetes and hypertension, and probably some emotional stress as well because there's such a change. The addictions or substance abuse in this community is not bad in comparison to communities in the south, but I fear that that's probably going to be another challenge in this community when they're not able to do the things that they're happy doing. I think that the remoteness and isolation here has actually been protective for the community because people maintain their traditional lifestyle because they have to. And so, there is a fear of what's in the water and what they're drinking and what's in the fish and what's in the game that they're eating. So that also is affecting whether or not they're going out doing the things that they want to do. It's affecting the mental health in the community and people coming in more often for screening for cancer because it is a fear in the community. We did see a lot of deaths this year secondary to cancer, but we don't know how that is linked to the changes in the environment. So I think it's really important that a baseline study be done. This community is a beautiful community, and it is going to go through some serious changes in the next 5 to 10 years because of all that's happening, whether it be perceived or real.